My name is Andrew with Creative Electron, and today in our CT system, we're taking a look at a pacemaker battery. Now, these sorts of batteries are very precisely engineered for applying a very precise electrical charge to the heart in the case of, a tachycardia situation or an arrhythmia. Basically, when your heart doesn't beat in the rhythm that it should, a pacemaker helps put it back on the right track, and these batteries are what give that pacemaker the ability to do that. This battery, like most dry cell batteries, uses alternating series of wafers between the anodes and the cathodes. So on this, you can start to see at the bottom the gaps between the wafers, and so they'll alternate back and forth. Cathode, anode, so on and so forth. And then most of the time you'll have two pins at the top of the battery like this. One for positive, one for negative, your cathode and your anode. On this battery, you have the cathode sticking out the top, which is a gold-plated connector. Gold because it resists corrosion and tarnishing, and basically you won't have to dig inside somebody's chest to fix the battery. And the anode is actually the box itself. So you can see, if I rotate this, there's a couple of tabs right up here where the anode wafers are welded directly to the outside of the box, and there's one on the other side as well. The important thing with these batteries is, you might have heard about the Galaxy Note 7's issue with their dry cell batteries, and the reason that happened in large part was the expansion and contraction of the layers. You need a certain amount of gap there. So what our machine is good for is being able to look at an image, take a CT image of the battery, and check the gaps in between. So you can see, the gaps look fairly straight, all of the wafers look fairly straight. There doesn't seem to be a whole lot of bulging or anything like that. The anode is welded directly to the box, but you can see the cathodes all have this, the cathode wafers all have this, little point coming off the top of it. Those are all welded to cables that are then welded to the gold connector pin. And that just gets pushed into a spring clip in the larger pacemaker device. Yeah, the TruView Fusion CT is a great tool to be able to look inside one of these batteries without having to destroy, who knows how many months worth of engineering. To make sure that you build it, that it's built right the first time, every time. Thanks for watching, and we'll see you again soon.
Creative Electron.